Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller. And today we have a very special guest, Dr. Heather Doty. Dr. Heather, why don't you tell us a little bit about who you are and what you do?
Hi. Hello, everyone. Thank you so much, Dr. Reller, for inviting me onto your podcast. This is super fun for many reasons. So I'm a family doctor. I'm an osteopathic family physician. Been practicing for about 20 years in family medicine, urgent care medicine. And now I've started my own direct primary care practice here in the Charlotte, North Carolina area. And I'm super excited to be on this podcast because my family is actually relocating to Southwest Florida this summer. So Tampa is beautiful. We're going to be living a little further south toward Naples, but what a beautiful place. Talk about a great place to be healthy. What an amazing place to live.
Absolutely. We're super lucky here, but I do like North Carolina as well. So
Okay.
you're lucky too. You get the mountains, the water, and everything else in between. So yeah, welcome to the podcast. And today, everybody, we were going to talk about intermittent fasting, a super hot topic. And I'm sure you've heard things on social media or things in the news about it. And Dr. Doty is practicing this herself and thought it would be a great discussion to bring to you. And anyway, so let's dive right in. What is intermittent fasting?
Yeah, so intermittent fasting, and let me just share that as a family physician with, again, about 20 years of experience, I had never heard of this until probably 3 years ago. I was a teacher, a family medicine teacher of residents, and we had a guest lecturer who she actually has a longevity practice. Never heard of that before either. And so she gave us this lecture. It was during COVID, so she was on the screen, and we're in lecture 3 hours every Wednesday, and I try very hard to pay attention, but coming near the end of the lectures, I get a little sleepy, but she came on and I was fascinated. I actually was searching for scratch paper and I took 3 pages of notes because I thought, this is amazing. This is incredible. What a great strategy for our patients to use. So I started intermittent fasting about 3 years ago, intermittent fasting, because I had a lot to learn and I am still not an expert. Dr. Reller, I told you that before. I'm definitely not a topic expert on this, but I love it. I love to learn about it. I recommend it to my patients. So intermittent fasting is a way of really capitalizing on our body's ability to self-maintain and heal. And this is one of the things as osteopathic physicians, it's foundational for us. So let's capitalize on what our body can do and its own resources. So intermittent fasting, and we'll talk about the terminology and more specifics about what it is, but it gives your body rest, which is in this crazy society where we are just on this treadmill in every way. Intermittent fasting is a way of resting your body so that it can actually promote its own healing from the inside.
I haven't heard that interpretation of it before. So go on. I interrupted. So
Yeah, no, that's okay. So, I mean, in its simplest forms, that's how I like to view intermittent fasting, because when you fast, your body has the ability to take a break from everything, really. Mm-hmm. So we talk about 2 places that our bodies can find itself in. It could be in a fight or flight mode, which is where probably most of us spend our day, going from one thing to the other, or rest and digest. And simply put, I think intermittent fasting even takes away the digest part, and it really allows it to rest. And we'll talk about the really cool benefits of cancer prevention and longevity and the way it can affect our mindset and our brain's cognition or its ability to think. So there are just tons of benefit, but it really just allows the body to focus on itself.
I like that. I had recently discussed like meditation and taking from the sympathetic to the parasympathetic. So I hadn't heard this interpretation for intermittent fasting to do the same thing. So that's really, really awesome. So we were talking about the different definitions of intermittent fasting versus time restricted eating before coming on. So I didn't know if we could together clarify the difference. So as far as intermittent fasting, how would you define that?
So
for just the timing part. Yeah.
Yeah. So intermittent fasting would be exactly what it says. So fasting your body, removing calories, removing food intermittently. And for many people, this can look like a prolonged fast, a 24-hour fast, a 36-hour fast, sometimes even extended week-long fasts under the supervision of your physician, of course, done intermittently. So in between those times, there could be days or periods of time where you're eating normally, but it really is putting your body into this lengthy fast intermittently between normal periods of eating.
Okay, so some definitions that I've heard before are these alternate day fasts, kind of like you had mentioned. And what happens, you eat normally on one day and the next day you would restrict, usually like 500 calories or less, depending upon what you're doing. And sometimes that's like bone broth. And then the next day you would normal and then once again restrict. So that's like the alternate day fast. And then there's such thing as a 5-2 fast. So the 5 days of the week you are eating normally. And then 2 days of the week, usually not consecutively, you choose to do that like 500 calories or less day. And I know you mentioned that you had just heard it 3 years ago, but this is something that has been practiced for a very long time. I don't know what sort of source dating we can think about it, but I know that their whole feast and famine theory of, like, I don't want to say cavemen, but in the past, there would be in ancient times, they would have a big feast and a celebration, and then they would actually fast for that. And with food so readily available to us now, we don't do that. So I feel like it's something that we could model and obviously benefit from, like from our ancestors. So was there any more clarification that you wanted to describe with the difference between like time restricted eating and intermittent fasting?
Yeah. So I want to go back to something that you just said, which is really interesting because I just said, I'd never heard about this before. And you hit the nail on the head. This has been done a long time. Yeah. We've gotten into this society where we're just a snacky society. Even today, I was like, kids, do you have your snacks? Do you have your snacks for this little, make sure you're feeding yourself all the time, because we feel like we need that. We're very self-absorbed. I'm very self-absorbed and we need our food. So if we look back even at the turn of the century, well, I should say the turn of the last century now that I'm aging, but, they didn't snack. They ate their evening meal. They worked very hard all day long. They were busy working. They didn't snack. They ate a good meal. They turned out the lamp and they went to bed and they woke up and started it again. So they naturally had what would be less referred to as intermittent fasting, but a restricted feeding window or time restricted eating. That's more what I practice. I feel like that's easier to wrap my brain around. So if we can go in that direction a little bit, I feel like that's an easy button for most people's metabolic health. So you pick your eating window or your feeding window. And for many people, that will be 8 hours is pretty easy. I'll tell you, anything over than 12 is better than what we're currently doing in society. Most people are eating up until probably 8 or 9 o'clock at night. Again, my kids, I hate to throw them under the bus, but it's 8:30. We're getting ready for bed. Can I have a snack? No, you're getting ready for bed. So again, even stretching beyond 12 hours, you'll see some benefit, but a good beginner time restricted feeding window would be a period of about 8 hours where you fill all of your calories into that 8-hour period. And then the rest of the 16 hours of the day, it's water or black coffee if you really need it, or black tea. So that's just a little snippet on time restricted feeding, which I find to be very easy and very practical for most people.
Yeah, I totally agree. I think that the time restricted eating is more doable and easier to bring to our patients or anyone looking to change something up. But I think those are great points. Don't get me started on the kids and snacking because I could go on forever. But also you mentioned how in the previous times they would turn out the light. And I think even going before that, before there's electricity, right? The sun went down, they're going to bed, right? They're getting up to do their farming or whatever. And they had that huge window of fasting that we just don't have now. So really going back to model of the times that how our body was really developed to be in is kind of what this, I think, approach brings. So it's nothing new, but maybe new to the listeners and definitely new to, I think the popular time too. So you mentioned some of the, before I go to the benefits, I should say, what is it kind of doing to our body? Can you describe basically what's happening metabolically when you are fasting?
Right. So several things happen when you're fasting. And again, I am not a technical expert in this. In fact, I saw that you're an obesity medicine expert and I thought, oh boy, she probably has a whole lot more technical information than I do. But again, it just allows our body to focus on healing. I think it will decrease hunger hormones. So that's one thing that has been documented medically, that if you do a prolonged fast, even for 16 hours, it can lower your hunger threshold. So it can decrease the time that we are actually hungry. Takes away some of that stress as well too. It actually helps the body to mobilize glucose from good sources. It can pull glucose from the liver and get it out of our organs as well too, to get it out of the body and stop congesting the liver, for lack of better terms. So it's a great way to mobilize glucose. It can push your body, if it's a prolonged fast, it can push your body to burn fat as a fuel source, which is great for people who are looking to use this for weight management purposes. So because there are no external calories for it to use for fuel, the brain needs to fuel. So it's got to find other fuel sources. We'll probably talk about ketosis at some point. If you go long enough into a fast, your body really is forced to use fat for fuel because it has no glucose, no sugar, no other calories available. So put in very simple terms, it really allows our body to pull fuel from sources where our bodies have stored it, where it was never meant to store. We're not meant to have fuel stored in our liver and around our organs. So it really helps our body to mobilize those sources that are not helpful for us.
Yeah, absolutely. So that is what I was getting at. So basically taking that fuel from carbohydrate sources that you're not currently consuming while you're fasting allows the body to use the fat for fuel, right? And that fat, you can burn it, and then it creates what we call ketones. And ketones and glucose are the only things that the brain can use to fuel itself, right? All the muscles and everything uses glucose, but the brain can still survive and work very well on ketones alone. So that is one thing when people talk about it, they talk about being in quote ketosis, right? But yes, you're right. It has to be pretty prolonged to get into that zone, or at least, on those days of restricted calories, you could stay into it a little longer as well. Any other comments on that? Or
yeah, and it's along the same lines. So the thing with intermittent fasting or restricted feeding windows, I think that there are some unseen benefits that are incredible. One of the most fascinating things I'm reading about and learning about, and the thing that really caught my attention that we don't feel and we don't see, it has more to do with longevity and unseen benefits, is this idea where when our body is not distracted by either the toxins that we put in our foods, like the glass of wine at night or the snack that we had at night, when it's not distracted, it actually mobilizes cells in our body to go after other cells that are harmful. So cells that have errors within the cell that we can't see. Our own body will go through a process called autophagy, which is a fancy word that I learned about a few years ago, where our body fights its own precancerous cells. And that's amazing to me. That's an unseen benefit. And that's something when intermittent fasting or time restricted feeding becomes difficult, because it is a discipline, truly is a discipline. We will always revert back to the old ways. We have to think about the why we're doing that. And that's one of the things that's an unseen benefit where we could potentially reap benefits decades down the road. So again, it's not weight loss. You're not seeing pounds drop on the scale. We may never see the tangible benefits of that, but this cancer prevention that's being cited in the literature and is really, I think, a hot topic in medical research right now is fascinating to me.
So you're saying the body, as it's resting, can basically work against and eat up all those bad cells that may be developing. Okay. Yeah. We used to think of that like the phagocytosis, right? As the cell is being eaten by another cell, like to destroy it. It's basically destroying the cancer cells. So that's obviously an awesome benefit. What are some other benefits of intermittent fasting?
So I was listening to a great podcast yesterday. For those of you who want to do a deeper dive, and this would be a very deep dive, there's a doctor that Dr. Reller, I think you've listened to him as well. His name is Dr. Peter Attia. It's Attia. And he has just a wealth of knowledge in this area. He's very well studied. He really provides a lot of evidence. He does a very deep dive into the technical aspects of time restricted eating and fasting. And I was listening to an interview yesterday that he did with a nephrologist. So that's a kidney doctor. And this kidney doctor treats mostly diabetes patients. And he uses fasting. He actually does true intermittent fasting as well as time restricted feeding for his diabetic patients. And he is seeing patients completely reverse their diabetes. entirely. And I've wrestled with this because I've had discussions with some colleagues. Are we reversing diabetes or are we controlling it? And he said, no, it's gone. So, and again, that's probably a debate where we would have, I think we would, even with my colleagues, we still have debates about this, but he would say he puts them on an intermittent fasting regimen and he does prolonged fast. He'll put patients on fast for 7 days out of the gate, which is very aggressive. Please don't do that without talking to your physician. Okay. And he has seen incredible results, patients coming completely off of insulin. He gave an example of a diabetic patient who had a very bad wound on his foot that's associated with, it's a known complication of diabetes. And he thought, this guy is on his way to having part of his foot amputated. So he immediately put this poorly controlled diabetic on a prolonged 1 week fast. He said, this is going to be difficult, but I want you to do it. And the ulcer healed within 2 weeks with no other intervention, which was incredible. So there are folks out there, and again, he's an expert in the area. He's been doing this for years. So he's not experimenting on patients, but the results he's seeing specifically with diabetic patients is incredible. And I hope to get to the point where I have enough experience, because I had a patient tell me the other day, well, Dr. Doty, I would rather take my medications. I'm on 5 medications. I can take those and then eat all the sugar I want, which is the easy way. Mm-hmm. It takes discipline to do these lifestyle changes, but if fasting is free, time restricted feeding is free, there are no side effects apart from maybe a little brain fog early on, but I feel like it's a modality that we can use. It's one of many things. It's never the only thing, but I think specifically in the diabetes realm, I think it could have tremendous impact.
I agree. I will say a disclaimer there, because nobody that has diabetes should do it without the consult of their physician, because that is definitely one of the dangers of hypoglycemia and everything. So just to make sure that you're doing it under, I mean, these people, this is amazing results that they're having, but they're following very closely with their kidney doctor. So I would, if I were anyone that had diabetes, I wouldn't do that without physician guidance. Absolutely. Yes. Yeah, that's pretty amazing. I had not heard of, wound healing for diabetes if you just fast, but I mean, there are definitely patients where they want the easy way out. They just want to take their medicine and eat whatever they want, which is fine, right? As long as they're controlled. Sure. And the ones that maybe are more motivated to get off medication, then that's the case. I might be on the team where I would argue that it's in remission versus cured just because of the tendency to have it in the first place. But I guess it's a debate. So willing to debate at another time. But anyway, so we've got good benefits on the improved diabetes control, which obviously would improve insulin resistance in general. And then we talked about cancer prevention. You mentioned a little bit about the brain. So any comment on that for benefits of intermittent fasting?
Yeah, I think just anecdotally, I don't know that I have any clinical evidence to support this, but anecdotally, I would say that the patients that I've walked through, and even in my personal experience, I think it does bring a mental clarity. And I think for several reasons, and I think it's multifactorial as well, too. I think just fasting alone or time restricted feeding alone won't give us the great benefits, but it's when you couple that with the other things, like making sure you're drinking enough water, making sure you're sleeping well, and you will sleep better. If that's another thing, if you're not eating late into the evening, your body will be able to get better restorative sleep. I just listened to your podcast with Dr. Brown, who brought that up as well too, and it was excellent. So it's just another benefit. Sleep is more restorative. Therefore, the next day, your brain feels more awake and clearer. You can think much better. So I think just that mental clarity. And I think the discipline of time restricted feeding or intermittent fasting also, it strengthens our brain. Granted, our brains are not muscles, but we can think of that. It's mindset training. So if you have the discipline to employ these methods, I really do think it sharpens our cognition in our brains.
I know you said brain is not a muscle, but when people think of it as a muscle, that you have to continue to train it in that way, then you can, do those improves. It's like improved habits, right? Yeah. And the brain is able to change, right? It's able to get stronger, if you will, and change the circuitry. We call that neuroplasticity. And I think that those are definitely benefits. There is a study in the New England Journal of Medicine in 2019 that showed that intermittent fasting does improve brain function. It can improve longevity, which I think you kind of hinted at earlier. And there was one other thing other than that, things you already mentioned, like, decrease in diseases and things like that, like cancer, obviously, possibly obesity as well. Mm-hmm. So, I think there are other things like decreased inflammation, decrease or improved heart health. And, the weight loss is a possibility, but I think like we were talking earlier, you got to pair it with these other habits of sleep and water and all other, actually calorie restriction as well. So can you think of any other benefits, or did we kind of cover most of the benefits?
Yeah, I think, there are two other things that I want to mention. So I did look at a study where they compared, because most people, when they want to either lose weight or get healthy, so to speak, will restrict their calories. That's probably the most common way that people do that. And when they compare calorie restriction and time restricted eating or intermittent fasting, they both have roughly the same result in terms of weight loss. But what the studies have shown is that with intermittent fasting or time restricted feeding, patients don't tend to lose lean muscle as much as they would with calorie restriction. And the more I'm learning about the importance of having lean muscle for many reasons, metabolically, having strong muscles and good lean muscle tissue, it's so helpful for just the energy that we need every day. It will help us to burn more fat. It sort of is self-perpetuating. So if we have a choice, lose 10 pounds by restricting my calories or lose 10 pounds and keep all this good muscle tissue, I'm going to choose the latter. And so that's being shown pretty clearly in the data as well, too. So I think it's just another strong reason to maybe dig a little bit deeper into time restricted feeding or intermittent fasting. The other area where I've seen it, and again, I don't have data to share on this specifically, it's more anecdotal, but I've seen women who have difficulty with PCOS, infertility issues, and they've employed time restricted feeding, and their hormones tend to self-regulate better. And they're able, again, this is not the cure for PCOS or infertility. There are lots of variables that play into that, but it may be a helpful tool. That's another area that I have an interest in lately that I think may be helpful to our patients.
Okay, so I like what you said, a couple of comments. So I don't know if intermittent fasting and calorie reduction, either way, keeping muscle on is obviously beneficial. And one of the things that we worry about when people are losing large amounts of weight, right? We want to make sure that the muscle is not the part that's being lost. Like you want to maintain your lean mass, no matter what is going on in whatever method. We actually had an awesome lecture at the obesity medicine conference this past weekend about that and protein intake. And it was awesome. But one of the huge underlying things at that conference was about maintaining muscle mass and resistance exercise. So if you're incorporating resistance exercise, I don't think it really matters what method you're doing for weight loss or whatever, but it is imperative really to maintain that muscle mass for longevity. And like you said, for the metabolic rate. And then you mentioned PCOS and everything. So I thought it might be a good segue into finding out who it would be good for to be intermittent fasting.
Right. That is $1 million question. And again, preface all of this by saying, talk to your physician.
Right.
If you're not aware of these eating patterns, then encourage them to learn more, because I think it's a really fruitful area. But, I think for any adult, honestly, for any adult, I think it's worth looking into. Certainly folks 18 and over, we don't want to employ these strategies in children. And I would say for the patient, the way I approach my patients. So for example, the patient that I saw who's diabetic, he's controlled on all of his medications. That's what he's comfortable with, and that's what he wants to do. And I said, great, that's fine. That's where you're comfortable with. If you, however, really want to work toward longevity, better health, more energy, maybe a little weight loss, mental clarity, better sleep, and you'd say on a scale of 1 to 10, I'm at least at a 7 or higher with regard to my willingness to do these things. Because honestly, it really starts up here. It really is a discipline more than anything. I think it's an easy button when you really get into the habit of time restricted eating or intermittent fasting, but it is a discipline. So you have to have desire. And I think once you have a willingness and a desire, anybody can do it. And I think anybody would benefit. So I don't know that there's a particular patient population. I'm getting to the point, the more I learn about it, the more benefits I see. I think it's great for anybody who would want to try it and employ the techniques.
I totally agree. Obviously, this is not for kids or teenagers, and for adults that I think a lot of people, like you mentioned, the hormone thing. I think that a lot of people who are struggling and have tried a bunch of things and they haven't tried anything else like that's being that successful. I think it's a great, great tool to implement. So I totally agree. And I feel like that age, like where it's like, you're getting a little closer to menopause or even around menopause, it's usually a great time for people to do that. But who is it not good for then?
So again, I think elderly patients, I have seen it done in this patient population. Do not try it without the guidance of a physician. Anybody who has chronic health issues, specifically diabetes, that would be the biggest one that I really think you need physician oversight. So I wouldn't say don't do it, but I would say find a physician who's very comfortable using these techniques and counseling patients through them. Before you do that, pregnant women would be another issue, maybe breastfeeding women. Again, certainly wouldn't do it without someone walking you through the technique safely.
So the only other person I might add to that, if you didn't say it, was eating disorders. Did you say that?
Yes.
Oh, okay. Yeah. So
Great catch. Yes.
okay. Yeah. So anybody with eating disorders, I think you really got to tread carefully there.
Yes.
So I think that's hard. And I think people that when they try it out and they're so ravenous later in the day, it might not be their best thing either. So that's something to think about. And then I've heard and read some things about gut health and stuff. So it actually can help gut health or not help gut health. I don't know. But I think really figuring out what's best for you if you're suffering from constipation or something like that, if it's really going to affect that in a good or a bad way, it's hard to say. So I think just kind of working with your doctor on that can help. So is there anything that we didn't cover related to that?
Yeah, I think just a couple of things are popping into my head that might be helpful for people who want to explore this. I think, again, it's one strategy, it's one tool. I think it works great for people who really want to clean up their eating. Honestly, I find that even for me personally, if my eating is off and I'm eating not great food for my body, it's really hard to fast the next day. It can also be really hard to fast if you're in a time of intense stress, because fasting is meant to rest the body. But if you're trying to force the body to rest and it's under duress or stress from whatever life is putting on your plate, that might not be the best time to fast. And I think the other thing too, and I like to say, we're human beings. We're not the same every day. We're dynamic and we change. And so fasting has a way, I think, of helping us to learn and to really listen to our bodies and to be kind to our bodies. This is not meant to be torture. It's meant to, as a kindness to our body, to help it. So if you have a few days here and there where you're just off, it's okay. This is not something that you really should be so rigorous that it's torturesome. It really should be a good thing. But again, I can't emphasize healthy eating enough, because I think trying to fast when you're fueling your body with things that are not great fuel for it, it's really difficult. So if I had to counsel somebody, I'd say, let's focus on your eating first. Focus on good things first. Let's get some really good habits in place and start small. I'm not one to change everything all at once. And then let's try the fasting. And so pick one or two things in your life that you can make an improvement. Don't try to do everything at once. That's really when failure comes. So we want to make small steps towards success.
I think that's a great approach, kind of fixing whatever habits that may not be working well to suit them at that time. So I would be remiss if I didn't mention the article that did come out in May 2022 in the New England Journal that compared intermittent fasting and calorie restriction versus calorie restriction alone. So that whole point is probably they're both restricting calories, eating healthier foods, right? So compared from one to the other for weight loss in general, the calorie restricted and intermittent fasting did lose more weight. They lost about 8 kilograms in a 12-month period, whereas the calorie restricted alone without intermittent fasting only lost, I think, 6.5 kilograms. It ended up not being statistically significant. So in order for this to be a good, weight loss tool, you do have to incorporate a little bit of calorie restriction and healthy foods in general. But it can definitely, like you said, work on behaviors and habits and mindset, and that alone can help improve the weight loss in addition to eating healthy too. So you can't just kind of do intermittent fasting and you eat whatever the heck you want. So yeah, you have to be eating healthy as well. I wanted to have you share your personal experience on intermittent fasting. So can you tell us about your personal experience?
Yeah, so it was, so I learned about intermittent fasting from a colleague about 3 or so years ago, and I tried intermittent fasting while I was eating not great. And it was okay, but it was really difficult. It was just not super enjoyable. I'd break my fast with an artificial protein bar or something like that, not real food. And so I actually became aware of a program called the Faster Way to Fat Loss. I don't know if you've ever. I didn't like the name at all. It was kind of off-putting to me. And then I realized it hinges on intermittent fasting. They refer to it as intermittent fasting. It truly is time-restricted eating is what they're doing.
Mm-hmm.
But they employ clean eating, whole foods, focusing on building lean muscle, lots of water, and then time-restricted feeding, and all of these things. So for Mother's Day last year, happy Mother's Day to all the moms out there coming up soon. So last year I told my husband, I said, for Mother's Day, I want to feel well again, because I feel tired. And I was doing as a physician, I was doing most things okay, but I just felt tired and just fatigued and weary and had no strength. And so I gradually employed really good habits of time restricted feeding. So I do an 8-hour eating window most days and a 16-hour fast, minus my cup of coffee with some stevia in the morning, because I'm not giving that up. I really increased my water intake, again, eating really good whole foods, working out 5 days a week, and I felt great. And I'm still, like I tell everyone, I'm still human. I have days. Today I feel a little more tired than most. So I listen to my body. And if I'm in a season where stress is higher, I may not do time restricted feeding as much. So it really has enabled me to fine tune my own wellness approach. And it's been super fun. Again, it's free. These techniques don't cost anything. Fasting is free. I feel like my mental clarity is better. My energy is better. So it's just been great. And I'm approaching 50 and I'm determined to go into my 50s healthier than I was in my 40s. So these are just the techniques that I personally have found great benefit from. So it's been a fun journey and I still have a whole lot to learn.
Cool. Yeah. I will share my brief story because I haven't really done it that much. But my theory is if I'm not hungry in the morning, I shouldn't really just eat, right? So on the days where I'm not hungry for breakfast, I have tried it and, it usually feels really good, especially I have some stomach things and I think that it makes it better. So I've only done it a handful of times because it's newer to me for me actually practicing, because I'm the type of person that if I skip breakfast, I'd be super ravenous later in the day. So I didn't really think I was a good candidate. But on the days where I'm not actually physically hungry for breakfast, I think it's a great opportunity to step in there and do that. And so it ends up being more on the weekend when I have that attempt, more so than the weekdays. But I also like to say, if you're not hungry for breakfast, it's okay not to eat it. You're not going to, just don't fear the fear of hunger later on. It's normal to get hungry. It's not going to kill you. So I kind of try to focus on that with my patients if they're interested in trying it too. But it's just a brief thing. And I think that I do have better mental clarity and everything like that. And definitely the stomach thing. So I need to try it more, but I'm new to that. So that it's a very minor, brief experience for me actually practicing intermittent fasting. Now, my husband's tried it a lot more than me, and I think he likes it as well. But I don't really think we're actually trying to lose weight at this point. So it's really just to feel right and eat when we're actually hungry and not eat when we're not. But anyway, is there anything else that you wanted to add?
No, I think, again, I can't emphasize enough, this is one tool. Everybody is a unique individual. And so there are lots of ways to approach wellness. And this is just one thing to consider among all the other things. But what I love is seeing this shift. And Dr. Reller, I know you'll appreciate this too, just seeing a little bit of a shift toward more lifestyle medicine. And we need pharmacology. We need it. We cannot treat infections without antibiotics. We can't cure cancers, arguably, without these chemotherapy agents. But there are lots of ways to get healthy without medications. And I love seeing patients and physicians kind of wake up to that a little bit and just utilize some of these strategies. I think it's helpful. I think as a society, we have the potential to become a lot healthier by really maximizing our body's potential. So that's my little soapbox spiel that, in the latter half of my career, I think I'm a little bit more passionate about. And I know you are as well too.
I love it. Yeah. I mean, I definitely am trying to promote lifestyle medicine and lifestyle changes more than just throwing things like drugs at them. So totally agree. So where can people find you if they want to work with you?
Yeah, so social media right now is the best place to find me. I have a Facebook page. I can only handle one social media realm at a time. So Facebook, Crossroads Health and Wellness is my Facebook group, and that's the easiest place to find my website. The website is crossroadshealthandwellness.com. It's got hyphens between each word, but the Facebook page is the best way to interact with me. I'm active there. Message me if you have any questions. Love to get connected.
Awesome. Well, thank you so much for coming on the podcast. It was a really fun discussion today. And I hope everybody will tune in next week for our next topic, and have a great day.